Hi, everyone. Good afternoon. Thank you for joining us for this special conversation with Dr. Dhruv Khullar. For those of you that may just be learning about the Medicare Rights Center today, we are a national nonprofit organization that is dedicated to helping older adults and people with disabilities access and afford their health care through counseling and advocacy programs, educational programs, and public policy initiatives. I'm pleased to welcome Dr. Khullar. If you don't mind I'll call you Dhruv as our special guest.
Please.
He is a practicing physician, associate director at Weill Cornell Medical College. He's also an associate director of the Cornell Health Policy Center, and many of you probably know him from his speaking engagements and as a contributing writer to the New Yorker magazine. So it is a true honor and pleasure to be able to have you here today. Thank you for taking time out of your very busy schedule to speak with our audience about some very important and timely issues. For those
I'm
of
so glad to
you,
be here. Thank you.
thank you. Thanks for being here. And Drew, so you attended our event and you gave a fantastic keynote speech, but it was just way too short. And so I'm hoping today we can kind of delve into our topics. And I think what's really unique about your bio is that you're not only a practicing physician, you're treating patients, but you're also deeply involved in health policy research, analysis, and then you take that information and you are providing it to the public in a very compelling way. And so just to kind of step back, given how unique that is, can you just kind of tell us a little bit about how you came to do that? Did you grow up always wanting to be a physician, or were you always steeped in health policy? Can you talk a little bit about that?
Sure. Well, thanks for having me. First of all, it's really an honor to be here with you, and I've so enjoyed the work that you've done and learning more about it over the years. So a real pleasure to be here. So my father was a physician, is a physician, and I always say that that's a risk factor for going into medicine yourself. And so growing up, I knew that I wanted to be a doctor. I had this conception of doctoring as something that was truly noble, and I saw the way that my dad cared for people, taking the time to understand not just their medical problems, but their lives more generally, who they were, what was important to them. And I knew that that was the type of doctor that I wanted to be. And then I entered medical school and I started to see how the whole system affects the practice of medicine. So, how much we can do inside the exam room really depends on the structures that are in place outside of the walls of the hospital or the clinic, things like social needs or community supports, financing, public policy. And so I wanted to understand those issues more deeply. And that's why I pursued a career in research. And all the while, I deeply, deeply admired these doctor writers, people like Oliver Sacks and Atul Gawande and Jerome Groopman. And I loved their ability to synthesize complex information into a narrative that could not just reach people, but that could move people and that could help them understand issues, that could change their perspective of how they thought about something. So I started to write as a way to think about these complicated issues myself, but also to communicate them to a wider audience.
Well, you've had a very busy year. You've been incredibly prolific in your writing, and that's why I was so surprised to learn that you're also still treating patients because we've had no shortage of current events. And several months ago, and over a year ago, I read a piece of yours where you spoke to the importance of and the connection to of a healthy democracy and healthy lives. How can patients be healthy? How can communities be healthy? And given the stories that we hear every day on our helpline of people struggling to afford their care, just yesterday I spoke to someone who's going to drop their insurance coverage and wait until they're eligible for Medicare. I was just wondering if you could kind of revisit some of the themes in that piece. And when you wrote it a year ago, what surprises you now when you think about it?
That piece was really motivated by this idea that our democracy seems like it's in peril. And that's something that a lot of people, I think, feel these days. And if not in peril, at least not as strong as it used to be. And one of the things that social science research is increasingly showing is that that's not just a problem for people's rights. It's not just a problem for people's economic well-being. It's a problem for their health. And so there's research that suggests that all sorts of health outcomes um, depend on the strength of a country's democracy. And in fact, sometimes the strength of the democracy matters more than the size of the economy. And so research suggests that nations that transition from autocracy to democracy, they see basically immediate improvements in life expectancy and health outcomes, and those that slide backwards from democracy to something that's like an autocracy, they experience the opposite. And there's a lot of reasons for this. I mean, democracies, for one, they tend to spend more on healthcare than other countries do. They invest in basic science research and clinical research to try to keep their people healthy. You have a free press that keeps people informed. The rule of law fuels innovation. There are independent agencies that check power, that can implement regulations to improve clean water and breathable air. And so democracy is not just about politics. It's really about our health as well.
And so when we think about our healthcare system, we know it's an imperfect system. But we also know that it's valuable and we've had great advancement and improvement over time. In respect to the Medicare program, we have seen improved longevity of older people, since its inception, and it has made significant progress in creating more equal access to facilities and care and closing some gaps in disparities. At the same time, it seems like we're hearing a level of frustration about the system that has been exacerbated since the pandemic. And to your point around, having a free press, we also have algorithmic, rampant misinformation and lots of information about health that's available online too. And so this kind of brings me to this current moment over the last several months where there is a slogan, but it's also maybe a movement, and it's also a program that's called Make America Healthy Again. You've probably heard about it. So, Make America Healthy Again. I think that most well-meaning people agree that we all should have a goal for the government to support people to be able to live longer and healthier with freedom and dignity and independence. But sometimes I'm having a very difficult time kind of squaring the circle around other things that are happening in the system, the defunding of the agencies, as you mentioned, attacks against scientific research. What can you kind of dive into this a little bit and talk about what are some of the like long-term public health consequences of these actions that are also related to Make America Healthy Again, given that it's embedded into the federal government?
Sure. I mean, in a way, it's hard to talk about because, MAHA or Make America Healthy Again, it's not just one thing. A lot of people look at it from different angles and they see what they want in that movement. And so there are parts of the movement that I think get a lot right. And I want to start with that. So, for a long time, politics and healthcare politics in this country has equated healthcare with health, more specifically, health insurance with health. Now, don't get me wrong, health insurance is incredibly important. It's important that people have access to doctors and hospitals and medications. All those things make a huge difference. But health insurance is not the same thing as health. And to the extent that this movement, AHA, is talking about food and nutrition and exercise and sleep, that's all to the good. You wish that it weren't coming with the level of vaccine skepticism or the pushing of unproven remedies that are sometimes associated with the movement. But talking about health, in addition to healthcare, I think that's a positive development. Now, the broader challenge is that a lot of this rhetoric has been accompanied, I think, by actions that are going to hurt people and hurt people's access to health in the short term and hurt our healthcare innovation in the long term. And so if you think about passing legislation that makes Medicaid more difficult to access. That is going to harm people who need healthcare who are no longer able to get it. If you think about right now, what this shutdown fight was about, it was about health insurance premiums that are going to rise in the Affordable Care Act marketplaces unless action were taken, and action was not taken. And so a lot of people are going to see enormous sticker shock over the past next few weeks and months, and many may not be able to afford health insurance in the way that they were just a few months ago. Now, thinking longer term, what is most concerning to me is this effort, this kind of perverse effort, I think, to cut funds, to cut the NIH budget, to cut research into things like cancer and diabetes, Alzheimer's, infectious disease, vaccines, all these things that make us healthy, that make our country a place of innovation, that make us competitive on the world stage, and that affect all of us, regardless of our political persuasion. And so, at the very least, we should all be able to come together and understand that when it comes to chronic disease, infectious disease, these are things that affect everyone. And we want to have the innovation that is going to keep people healthy now into the future happening here in the United States.
Yeah, I was thinking about how we do have a complex system and we have many stakeholders, but at different points in time, certain entities were able to, step up and cure some diseases or prevent them. So one thing that comes to mind is with HIV prevention, and pharma was incredibly important in that, and of course the CDC at the time. And so our system has a big focus on health insurance, and it's been built from legislative expansions, but it also has morphed through the dominance of various interests, and it's in a huge part of our economy. And so generally we hear a great amount of dissatisfaction from patients about health insurance, big health insurance in general. And there is a level of cynicism about it that it just seems much stronger than ever before. I mean, our healthcare premiums are going up too. And what was always interesting for me when I used to hear the calls for Medicare for all, sometimes I wondered, well, how many people know that there are parts of the Medicare program that are completely privatized, like Medicare Part D, the prescription drug benefit, which is extremely important and has extended prescription drug coverage to 68 million Medicare beneficiaries. And we've had a substantial growth in another part of Medicare that's privatized, Medicare Advantage. And you wrote a little bit about that too. And the program is facing challenges from for-profit interests that don't necessarily always put patients first. And so one of the first pieces of writing of yours that I read was called The Gilded Age of Medicine. And that really resonates right now. And can you talk a little bit about what you were thinking at that time and some of the stories that you wrote about?
Absolutely. So the idea of the piece was that medicine has become a business, and not just a business, because at some level, it's okay for parts of medicine to be business oriented, but it had become a business like any other. And the ethics that should have suffused medicine and the delivery of healthcare seem to have been weakening. And so, too often, as you say, organizations are placing profits over patients, and the focus has turned to money instead of the mission of these organizations. And that can take many forms. And so, we've talked about private equity acquisitions of nursing homes and hospitals and physician practices, and some of the concerning things that happen often after those types of acquisitions in terms of cutting staff. So there's not enough people around to care for people. Infections in the hospital tend to increase after a private equity firm takes over. We talked about Medicare Advantage, which, as you note, is now more than half of the Medicare program. So 54% of Medicare beneficiaries get their insurance through Medicare Advantage. There are benefits of that type of privatization, but there's also been a lot of concern about overpayments to these health insurers, in part because of kind of the gamification of healthcare, the way in which you can code a patient to be a certain level of ill or sick. And once you do that, you get more money from the government because your patients appear to be sicker, even if the underlying level of illness is not different. And it would be nice if nonprofit healthcare was the salve to all this, but in many cases, we see even nonprofit hospitals behaving in ways that are basically indistinguishable from for-profit companies. And so all of these forces have created what I, kind of called in the piece, the Gilded Age of medicine, which is a term borrowed from a Mark Twain novel at the end of the 19th century. And he was talking about this era that is marked by inequality and greed, but it's painted in this kind of thin veneer of abundance and progress. So you have these new technologies, you have these new treatments that kind of give the impression that patients have never been healthier or more satisfied than before. But all the while, there are corporations that are wielding power at the expense of the people that they're often meant to serve. And one of the things that I have always loved most about medicine is that it has this kind of strange professional ethic. It's a norm that is taken kind of as given, and that physicians will provide advice and care that's independent of self-interest and profit. And it's not, I'm not naive enough to think that doctors and other clinicians have always lived up to that ideal, but I still think it's something worth striving for. That, we lose a lot when we submit to this view that medicine should be a business just like any other.
Yeah, and in same way that, we think about, sometimes we think about health insurance, maybe like a gym membership, where if you have it, you should be using it rather than it being there for the time when you need it. And when you do need it, it should show up for you and do what you need to, um, what you need for it. What's interesting is, stepping back and understanding the stakeholders involved, specifically in Medicare, but just in the healthcare system and the for-profit entities. We're in the middle of Medicare's fall open enrollment right now. And this is the time of year where many beneficiaries are reviewing their coverage and determining whether the prescription drug plan that they're in is the right one for them. Are their costs going up? Are their medications falling off the formulary? If they're enrolled in a Medicare Advantage plan, is this plan still working for them? If their plan has exited the market, what do they do? And what's been unique this year is, and to your point around the upcoding that's takes place in Medicare Advantage, is sometimes the connections are not super clear as to why a insurance company is offering a certain package. And so, just one quick example, we had someone that had reached out and shared that the Medicare Advantage plan that they're in offered an OTC card with a value of over $165. But if they accessed a small subset of providers, they would get an extra $30 of OTC. But when you look underneath the hood, you understand that some of these providers were owned by the insurance company, and so that may be a way to better coordinate care. That also may be a way to gamify the system. We're not exactly sure. But what was really missing from that decision for the beneficiary, the patient, was, well, how might my access to that additional $30 a month disrupt my relationships with my physicians? And we would look through the provider directory and determine whether they're in network or not, what hospitals were in network. And then when you dig even deeper, some preventive care that is, of course, it's free in Medicare, but it also has prior authorization. So these these policies really matter because they trickle down and they have unintended consequences, where sometimes it just feels that the beneficiary, the patient, are making decisions solely on a small incentive, but not realizing the possible long-term consequences. Given the breadth of these inequities and disparities, what do you think are some things that can be done incrementally to address what you had shared with us?
Well, I think what you're getting at is this idea of trust in not just institutions, but in the institutions that you are interacting with the system. And it's not a secret that trust has been declining in all sorts of institutions, government and media and academia. And part of that mistrust is earned mistrust, unfortunately. It is to have trust, you have to show yourself to be trustworthy. And there's a few parts of being trustworthy. One is being competent, being able to deliver on the promises that you're making to people. One is being transparent. And this is what you were talking about, which is, people want to know why you're doing things that you're doing. And then the third probably is this idea of your motive. Are you doing it to help me, or are you doing it to, line your pockets or to make a profit in some way? And so, I think people kind of get the idea that trust is an important thing, but they don't fully appreciate how vital it is to a well-functioning healthcare system, how vital it is to a well-functioning society. I mean, trust undergirds basically every interaction in a society, and a lack of trust really impairs the progress that we can make together. And I think we see that most clearly in the conversations, or the lack of conversation, that we can have about matters of public health and healthcare right now. And for many people, it's hard to know which sources to trust, where to look for reliable information, which is why the Medicare Rights Center is such an important part of this. Um, but to your last point, it's very hard to trust a system that makes it difficult to access care. That's not transparent. That could bankrupt you at any turn. I mean, think about what it would take to trust something like that. And so, we think about trust, I think, sometimes as an abstract concept. But to your question, there are very tangible steps that we can take towards creating a more trustworthy system, and that involves making it more transparent, helping people understand the basics of their care, helping people understand what they're going to pay for when they get a bill at the end of the day, making sure that the person that they call when they have a problem, maybe is someone they've spoken to before, that they have a relationship with. These are the types of things that start to engender trust in a system where it's been lost. And the last thing I'll note is that we often try to solve these problems at a national level, and we have national problems. But just like politics, healthcare is local. And so much of it is about investing in our communities, making sure that healthcare organizations, hospitals, insurers, that they all are responsive to the needs of the people who are in their neighborhoods and in their localities and in their states. And so I'd also just encourage people to, before we jump into every cultural issue that's on the national scene, think about what we can do locally and in our own communities.
Yeah, I think about the how to build trust and how to sometimes you have to build trust quickly. And one way that we build trust here at the Medicare Rights Center is I'm transparent about, who we are and what we do, and also share information about other entities in the healthcare system that they may not be aware of because that information isn't readily available. So, for example, if someone is looking at and evaluating an insurance product, telling them that I do not earn a commission off this product. And yes, insurance brokers can be helpful and they do serve a role, but it's also important to know that it's not just a one-time commission. It's almost like a royalty structure that after that first payment, every year that someone stays enrolled into a plan, and a broker will receive a commission. And I find that just being open and transparent about that helps someone feel more comfortable about asking for help, because there's nothing more vulnerable than, frankly, going to a stranger and saying, "Hey, I need some help navigating this because it's too complex, it's too confusing, and it seems as if everyone is coming to me offering something, but I don't really know what's best for me or what to trust. And I think to your point around investing in communities and working locally is really bringing in people to help them design what works for them and let them share what their needs are. And with the recent focus on the Affordable Care Act and the subsidies, sometimes we overlooked what else the Affordable Care Act has done in this country. At one point, if you had a pre-existing condition, you wouldn't be able to enroll into insurance, or there would be a maximum amount, a lifetime limit of what could be spent on someone if they fell ill. And so I think it's always important that we revisit maybe some of these rights that we do have now that we might even be taking for granted after just several years. To your point about trustworthy information, I said that you're a prolific writer, and then you just a few weeks ago you put out a fascinating article on artificial intelligence. And for the folks that are here with us today, we're going to talk a little bit about AI. And for those of you that have been reading about this, maybe you're using a form of AI like a chatbot. When I think of AI, I think of ChatGPT or these large language models. I feel optimistic about it. There's also part of me that is frightened by the potential of how AI might be used to alter the way that we connect and communicate in the healthcare system, but even beyond that. And I was wondering if you can just talk a little bit about Dr. Robot. Is that the piece of I call it AI. I don't want to refer to it as a human, but Dr. Robot, is that how you refer
Dr.
to
Cabot, yeah, Cabot.
Dr. Cabot? Dr.
Yeah,
Cabot.
I'll tell you about Dr. Cabot, which is it's a fascinating anecdote. Let me just start by saying that AI feels like the latest technologic revolution that we've had in the past, even just 2 decades. And it's of a piece with something that started with Dr. Google, where the way in which information was shared and accessed in the healthcare system started to shift from you could really only get that information from a physician to one in which information is much more democratized. Democratized is a positively valenced word. In a lot of ways, it's a good thing, but it also means that the information that you encounter can be less reliable. And so that is one of the challenges that we face, in this information ecosystem that we have now. So, I think about Dr. Google. I think about electronic health records, which changed the way in which medical records were stored and the way the information traveled across the healthcare system. There's telehealth, where you can access care from a distant location, and now artificial intelligence. And I think each of these technologic changes, they present challenges and opportunities. And so I can remember even at the beginning of my medical training, when I first worked in the hospital, we didn't have vital signs in the computer. You had to go to each patient's room to collect the vital signs that were in a little folder. And you could say that that was inefficient because I had to every morning and every afternoon walk all over the hospital, jot down the vital signs on a little piece of paper. But there was also something really special about it because it was a time where I got to check in on patients and we'd have conversations that we wouldn't otherwise have in the bustle of the day. And I guess I share that just to say that with every technology, something is gained and something is lost. And our challenge really is how do you maintain what is best about what existed before while harnessing what's new and exciting about the technology. So, so I think about the use of AI in probably a few buckets. I think
Mhm.
most people are thinking about it as a chatbot that you can talk to, and that's probably the most popular way. There's hundreds of millions of people that are using chatbots in that way. But I think the first place that AI is going to have an impact in healthcare is actually around administrative efficiency. And so there's a lot of administrative waste and a lot of administrative cost in the US healthcare system, much more so than there are in other countries. And I think AI could really be an advance here. So I'm thinking about things like billing and coding and documentation and prior authorization. And now we have ambient scribes, AI scribes that can record conversations and produce documentation by themselves. And then there's also some more technical things that we were talking about earlier, things like risk adjustment and coding practices that in a way could potentially be automated such that they're more equitable across different patient populations. So I think the first area that it's going to have a big impact is administrative efficiency. Then there's a few other areas that I think people are going to encounter it. One is clinical decision making. Can AI assist in medical diagnoses? We know that misdiagnosis is still a huge problem in medicine, and it's possible that AI could help people get to the right diagnosis more quickly. And this is where Dr. Cavett comes in, which was a research tool that's being developed out of a lab at Harvard that I got to evaluate a few months ago, and I traveled to the lab, and part of what the AI was doing was developing a presentation of a very complex medical case. There are these cases that are called case records of the Massachusetts General Hospital. They're clinical pathological conferences, and usually an expert clinician, someone who's been practicing, for decades, would walk students or trainees through the differential diagnosis and how they arrive at the final answer. And the AI was able to do this in minutes and not just do it in text format, but talk about it, reference the literature, talk about all the potential diagnoses and why these weren't right and those weren't right and these were right. Do it in a way that was natural and humorous. And you almost, if you closed your eyes, couldn't tell the difference between the AI and a human. So it is getting very powerful in that way. And I don't want to say that it's infallible. I think it's not going to be a replacement for doctors anytime soon, but it is something that could really support us as we try to deliver more efficient and more effective care to patients.
Wow, you shared so much. I think, to your point about electronic records, that seems very important. And if AI can help, share and analyze that data, that sounds wonderful. Um, Around the administrative efficiencies, hopefully that, will result in allowing physicians and other healthcare professionals to spend more time with their patients. I think about in the Medicare program, you may have heard that there is a pilot demonstration on the use of an AI software that will be applied for prior authorization for a few services in traditional Medicare that are deemed low value or prone to overutilization, or improper billing, etc. And I think I read that the American Medical Association has requested at least a 6-month postponement on that demonstration, given the misuse of prior authorization in Medicare Advantage. So that's one form of AI that
Yes.
we're concerned about because we don't know what tool it is, what information has it gathered to make these decisions, how is it going to make these decisions, etc. But to your point around the, assisting the clinician, and maybe in my lifetime, um, let's hope that it's not taken over by completely by AI. I think that's a good possibility. When we're thinking about that decision making, how might that impact learning for
Yeah.
someone?
So, just responding to the point you made earlier is, there's a real risk with an algorithmic healthcare system when a lot of the most important decisions are being made not by people but by algorithms. And so, I just want to flag that as these models become more integrated into the delivery of healthcare, we need to find ways such that the important decisions about people's health and their lives and their families are still being made by people and clinicians and the patients themselves because AI still does not have judgment. It cannot integrate your values and preferences in the way that a human can and should. So I want to just note that it's important to pilot these things and understand where they can really help make the system more efficient. But at the end of the day, humans, doctors and patients and other clinicians need to be the ones that are making the decisions. So I've been thinking about AI as a way to help patients actually navigate the healthcare system as opposed to produce the right answer or the right diagnosis or the right treatment right away. And so you could envision AI being very helpful in terms of scheduling and access, but also in terms of having better conversations with their clinician. So I've spoken with patients who have, with permission, recorded the conversations with their clinicians and then put that into ChatGPT and then have a conversation with ChatGPT about what had happened in the clinical encounter. Because as we all know, there's so much information coming at you often in a medical visit, in a short medical visit, that you don't always have time to ask all the questions that you want to. So you can ask some of those with the AI, understanding that it won't be perfect, but maybe it helps you prepare for the next conversation that you're going to have with your clinician and come up with potentially better questions at that visit. To respond to your last point there about clinicians using and relying on AI to assist with diagnosis, I think this could be a tremendous boon, but we have to do it carefully. And there are studies, not just in medicine, but in other fields as well, around this idea of cognitive de-skilling. And what that means is that, some of the skills that you've had trained and developed over the course of years and sometimes decades, those could actually atrophy if we're now relying on a computer to do a lot of the thinking that we were previously doing. There are ways that this has happened to all of us. It's not a big deal, like Google Maps helps us get around now, and I don't feel there's a huge loss in my life that I can't, get from point A to point B without my Google Maps. But
Uh-huh.
there are things in the realm of healthcare that I think are very important that we don't want to lose. And so, I've spoken to some medical students who have told me that they feel like it's hampering their medical education already. They walk out of a patient's room, they'll put the symptoms into a chatbot, they will put the labs in there, and it'll generate a list of diagnoses, potential diagnoses. And if you're not doing that cognitive work yourself, you're not going to build that muscle that you need to be able to properly evaluate and treat patients. Now, you know, the question is, what happens in a future where AI is really pervading medicine? And is it a big deal that we've lost some of the skills that we used to have? Before, doctors were probably more effective at listening to heart murmurs, or they were better at feeling the liver. And now we have echocardiograms and TC scans.
Mhm.
And people don't think that, we've had a big loss there. But I do think that there's something different about the cognitive work that goes into, interacting with a patient and coming up with a diagnosis.
Yeah, it seems, one question we got from the audience was, how can patients detect the use of AI to erroneously code or make erroneous decisions, and you kind of can swap out patients and you for other experiences and think, well, how can we detect the use of AI, whether that's the information that we're reading that may have been created by AI. And so I don't know if we have an answer to that yet, where because I'm not aware of any disclosures where if let's say a formal use of AI like a chatbot or an LLM was used, is there any requirement to disclose that, hey, this was partially created with the use of AI? I don't think so much.
Yeah, I'm not aware of any requirements currently to disclose involvement of AI in clinical care delivery. I should note that it's still very early in the adoption of AI. At the end of the day, the clinician and healthcare organizations are still the responsible parties, regardless of what inputs you use to come up with the treatment that you're going to deliver a person. Some of this will be kind of litigated in the courts, and we'll have jurisprudence around the ways in which we should think about joint care delivery between algorithms and humans. Um, but for now, I would say that, AI for any clinician should be thought of as an additional input into your clinical decision making. I have the patient's lab, I have a urine sample, I have an MRI, and I also have this output from the AI, and I'm going to take all those things and I'm going to make my judgment about what I think might be going on.
Yeah, it's interesting. In my private life, I use ChatGPT essentially to help me search the internet because Google search has been so degraded. But professionally, we have been working on an AI tool to modernize the way that we provide Medicare information, and we've done this through the generous support of Cornell Tech. And our goal was, if we're going to create an AI tool that provides Medicare information, we need to um, ensure that it's accurate, high quality, and that we trust the sources of the information where it's coming from. So we've kind of have been building I would say, a container of information. It's not sweeping the entire internet, but it's really focusing on the information that we've developed over 35 years, information that is in complex regulatory language that no one should spend time reading, but we're able to pull from there. And so far, it's testing really, really well. We're going to be launching that soon. But one thing that we were thinking about too was let's have, well, of course we'll have a disclaimer about it, but also let's be transparent about what this is and where the information is being pulled from. And then we're coupling it with access to our helpline. So if somebody has additional questions, they can call us and get some help. So this is a very exciting time that we're living in, but it's evolving. It feels like it's evolving so quickly. So
Yeah. Let me just say that I'm so glad that you're doing that. You're leaning into it. In part because people now sometimes look at the downsides of AI, and the complexity of it, and it's new and it can be scary. And there can be a tendency to turn away from it or say that we're not going to use it or we're going to really restrict it. But really, you can't stop a technology from emerging. You can only shape its use and use it responsibly and encourage others to do it the same thing. And that seems like the right way to do it. Being transparent about its use, disclosing and understanding the sources that you're drawing from. And then if there is an issue that is elicited by the AI, or if there's uncertainty, then a human takes over and is able to help the person directly. And so, this is something that is a incredibly complex technology, and it's moving and changing every single day. But I think we really need to lean into it and figure out how to make the best use of it.
yeah, we, when we first had started to learn about the large language models, we saw it as a potential to a solution. That we have very complex information. There's complex regulatory information out there, and maybe this tool can present this to the average beneficiary, in where we can provide more nuanced answers to the experience that somebody's having in the system. So um, I'm excited that we should be launching this soon, and we'll be sharing it with our membership and our audience and our clients. I have Drew, I have a few questions here that I'm going to launch into. I'm going to look at these. So there's a quick question that I'm going to just answer real quick. Has there been any progress on strengthening original Medicare, adding drug coverage, dental, vision, hearing? Um, the Inflation Reduction Act has improved prescription drug affordability for individuals who take very expensive prescription drugs, and there's a $2,000 cap. But this question, Drew, for you is on the topic of AI. Can AI really drive down costs, or might it turn into a high cost driver and then end up in premiums and deductibles, etc.? Do you see potential for it to make healthcare more affordable for patients?
I think so. You know, there have been many other technologies that have been adopted in healthcare that have almost always increased the cost, not decreased the cost of care. If you think about anything from imaging to new procedures, even to electronic health records, there are a lot of hopes that that could, improve care delivery and reduce costs. Didn't seem to happen. I do think that this is different. I think AI is much more flexible. I think it's much more powerful than those prior technologies. A lot of it now has to do with thoughtful implementation of AI and ensuring that when it is introduced, that humans are still making the decisions such that we get the most out of it without sacrificing, either patient well-being or professional satisfaction on the part of caregivers. But I think about things ranging from drug discovery and drug repurposing that can potentially keep people healthier, uh, more personalized medicine. So there's not this excess of treatment and diagnostics in people who aren't going to benefit, but you're really targeting and focusing on the people that might benefit from a particular set of treatments and therapies. We've already talked about the administrative waste that occurs in the medical system that could potentially be reduced by the use of AI. So I think in all these ways, there are opportunities for AI to make care more efficient and less costly, but a lot of it will have to do with having the political will and the medical ingenuity to make sure that it's adopted in the right way.
Mhm. Yep. And many of our questions are focused on AI. I'm going to pull one of the questions that's a bit more global. Someone asks, it seems that other countries have more equitable healthcare systems. Is there anything in another healthcare system from another country that you think could work well here or be applied here, or maybe hasn't been applied here? Is there anything that might come to mind when we think about prevention and other models?
Well, every other country has everyone insured, and so that's a good place to start.
Yeah.
So the first thing I would say is that the very basic function of a medical system is to provide care to people who need it, and we have not been able to do that despite having the highest healthcare costs in the world. And so anything needs to start from this idea that everyone deserves a basic level of healthcare in this country. And I don't think technology is the way that we're going to get there. I think that is a matter of political will and decision making and distribution of resources. And we need to make sure that everyone has healthcare, number one. On top of that, I think, other countries have other types of care models that have been proven to be effective. And so there are places that have a more of a private kind of system, more of a public system that use technology in a more judicious way than we do. There are trade-offs in terms of, adopting new expensive treatments versus restricting their use, of course. So I think that we can pick and choose the things that we like from other countries, but at a very basic level, everyone needs basic coverage, everyone needs access to primary care, and everyone needs access to preventive care.
What I've really appreciated about your perspective is we're not looking at everything in the terms of just, black and white, and we're really diving into the gray area because I do think, of course, there's a lot that we have to improve in this healthcare system, but there is quite a bit that is valuable. I think to the point of equity, we want it to be more equitable. So, it's not just based on, someone's zip code or their income will determine, what type of care they're able to access. And so I guess as just a closing and some final thoughts from you as we focus on the lives of patients and the communities that we live in, going back to maybe what you initially shared, what are some guiding principles that you kind of refer to as you work through your day, especially during these times of unpredictability and uncertainty?
I start by looking at history and taking a lot of hope from the progress that we've made. I think when you are in a challenged time, the temptation is towards pessimism. But if you look back, even just a few decades, to say nothing of the past century, there has been immense progress in every realm of society. And if you think about civil rights, if you think about education, if you think about healthcare, of course, life expectancy has doubled in that period. We didn't have a public system, and then we have Medicare and we have Medicaid. We have all these new technologies As you mentioned, just 15 years ago, 16 years ago, we could exclude people from health insurance because they had a pre-existing condition. Um, so, I think I start from a place of there has been a lot of progress that has been made. That progress, of course, doesn't happen by itself. It's the result of people like who are members of this organization and many others across the country who step up, who make their voices heard. And so, what always gives me hope is that when there are enough people who are informed, who feel strongly about an issue, we've always been able to make progress. I'm confident that we'll be able to do that again.
Yeah, I love that perspective. As an undergrad, I was a history major, and part of what I studied with the settlement house movement. And to this day, we partner with settlement houses. We're making a difference. We're changing people's lives. At the Medicare Rights Center, we're here to help beneficiaries. If you need help, you can call us on our helpline. We will help you navigate the system. If you're struggling to afford your healthcare costs, we help people enroll into very important programs, and then we're also advocating to increase the eligibility for programs so we can help more people. So I just want, everyone to know that we are here, we're making progress. And if you want to learn more about our mission, you'll receive some additional information after our session. But Dhruv, I just want to take a moment and thank you for sharing your insights, for sharing your writing. We're looking forward to more of your work. And also, I just can't imagine how fortunate your patients are to have someone like you as their doctor. So thank you so much, and keep up the good work.
Thank you, Fred. It's been a real pleasure. I appreciate your time.
Have a good night. Thank you, everyone.